It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives. Changing lives. Changing lives for the better. For the better. Changing lives.
And hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network, which features some of the best doctors in the entire Dallas-Fort Worth area, Candace, that help change people's lives.
That's right. We'll start off with our first best doctor. It's pain management specialist, Dr. Ken Reed, who helps another one of his patients with their migraines.
My migraine started March of 2009 from a faulty spinal tap, and right from there, my migraine never went away. I've gotten many treatments, a lot of medications, and I've seen countless doctors, and I just didn't get any relief. My mom and I went to Dr. Reed, and he felt like I was the perfect applicant for this stimulator.
I remember when Andrew came in for the permanent unit, we had to decide which side to put the battery on. It goes in the upper, outer, kind of rear gluteal region. Andrew wanted it on, I believe, the left side. Because he's a baseball player, he slides on his right side, so he wanted it on his left side. Which brings up an excellent point about the stimulators. There's no restrictions. Here's this very active young man, baseball player, sliding left and right, and no problem. He has done absolutely fine with the stimulators.
So I got my permanent stimulators implanted, and they put a little battery right at the hip, and it runs up your back. And I have 2 leads on my back, 2 leads on my temples, and 2 leads right here. And I'm able to control the frequency and the intensity of the stimulation with the remote. It's amazing what Dr. Reed has done, and I'm so appreciative of him.
He came back recently having lost a lot of weight. He lost so much weight, the little battery had gotten more superficial, and I needed to replace it a bit deeper in. But he was doing great with it. He's looking forward to going to college up at Texas Tech in a year. Like a lot of patients, he's done very, very well. I think it's safe to say that it's changed his life, certainly changed it for the better.
I don't care about having these batteries and these wires inside of me. I'm just so happy that my migraines have gone away. It's amazing what Dr. Reed has done.
Welcome. Today we're joined by Dr. Denton Cooley, a native Houstonian and the actual founder of the Texas Heart Institute. What a pleasure to be with you today, Dr. Cooley. Thank you for joining us.
Well, you're welcome, and thank you for visiting our institution.
Can you tell us a little background about how the Texas Heart Institute became an entity?
Well, it, I think, began in the mid-1950s when open heart surgery was first introduced in our Texas Medical Center. And before long, my program here at St. Luke's and Children's Hospital was probably the most prolific of all institutions in the country, including the Mayo Clinic, and Cleveland Clinic, and everything. And we had a simplified technique of open heart surgery and soon began a leadership position in this new field of cardiac surgery. Well, then I decided to create this institute in 1962. So it's been a little over 50 years ago.
What is your most vivid memory about the Texas Heart Institute, about any type of incredible learning that has been occurring here? What's your greatest memory?
Well, of course, our Heart Institute was created with two objectives, that is research and education. So in each of those aspects of our history, I think there are certain exciting things that have happened.
And when the Texas Heart Institute first came into being, cardiothoracic surgery was high on the list of available procedures to be done for patients. Now we have the artificial heart and the LVADs. And so would you tell the audience about that?
Well, I think that it shows the evolution of cardiac surgery. First, we started off replacing just some of the components of the human heart, that is the valves and the great vessels, and modifying the ventricles and that sort of thing. And then the big breakthrough came in 1968 when we did the first successful heart transplant to replace the entire organ. And that was really an exciting period that followed that. It was such a new concept.
Amazing, right?
Yeah.
And we have actual volunteers here at the hospital who have been survivors from cardiac transplant for about 20 years now.
Oh yes. Our initial work in transplantation, we did, I think, about 15 or 20 heart transplants in that early era. But so many of these patients suffered from rejection of the tissues. But in the early 1980s, a new breakthrough came with the development of a drug called cyclosporin, which is still in use today, and has made it possible for some patients to survive transplantation for 20 or 30 years. So it's a really big change.
Quite miraculous, and you are such a part of that endeavor, and we humbly thank you for everything you've done for the world population, actually.
Well, it's been a great satisfaction to me to see how this institution and our whole medical center has grown during my lifetime.
Thank you, and now we're taking you again all over the world with Best Docs Network, and we just wonder if you have something in these closing remarks, if you can tell our public something about the Texas Heart Institute that you would like them to take to heart.
Well, I think that we have done a great deal to reach our original objective of research and education. But at the same time, we've made many advances in just clinical medicine and surgery, and have enjoyed a leadership position in this new development now. It's sort of inspired the entire medical community around the world. And you can find large cardiac programs going in Europe and South America and elsewhere in North America. Just amazing to see how rapidly it's expanded.
Well, for all of us who have trained under your great leadership, we humbly thank you, and we give you great honor, Dr. Cooley. Thank you for being with us today.
Oh, thank you.
I had 2 children in the last 4 years, which is wonderful. I wanted to, get back to my normal shape, and I, started looking into getting lipo and things like that, and so I found Dr. Wilcox.
Well, liposuction is still one of the most popular cosmetic procedures done nationwide, as well as in our own practice. My preferred technique is ultrasonic liposuction, And that has proven the test of time. It's been present for about almost 15 years. Rather than just literally ripping the fat out, the cannula or wand is made of titanium. It's about this length. It has a hollow bore down the middle for suction. The tip of it vibrates over 20,000 times a second, and that's how it gets its name, ultrasound. And so we can just go back and forth gently until we can get about 2/3 of the thickness of the fat removed.
So I came in, told Dr. Wilcox that I would like to slim down around the hips, look at some areas of the stomach where the fat wasn't coming off. So he explained to me, he showed me what all he could do and what the result would look like. I was pleased with what his expectations were.
First of all, during the consultation, I make clear to them the best thing about coming to our practice is they're going to get the straight story. There are many patients every week who come in where I explain, you know, I don't think the surgery's for you. We may be able to offer a non-operative measure, or maybe they just need the encouragement to realize they don't have the problem that they perceive in the mirror. In Victoria's case, she came in requesting the breast enhancement and liposuction, so we looked at her and looked at the common areas that are usually done. And she has a nice figure and she was close to her ideal weight, but she had enough fat on her hips and abdomen that we could help her with that and make a significant difference.
I'm extremely happy with the results. They've exceeded my expectations as well as my husband's expectations. It is a quick recovery for such a big result that you get. It's just very exhilarating because I just have me back.
All of the doctors here at the Best Docs Network are dedicated to changing people's lives. Like our next Best Doctor, it's Mohs Surgeon, Dr. Patrick Walsh.
Mohs surgery is a surgical technique for the removal of skin cancer that enables us to examine all of the surgical margins of the tissue that were removed so that we're sure that we've gotten all of the skin cancer.
The first time I had any problem was out in California. And I had some work done in here. But the doctor told me, he says it might come back because they didn't have the Mohs system at that time. Then I had this one.
Mr. Wattier presented with a recurrent squamous cell carcinoma involving the right posterior auricular area. The posterior auricular area is the area behind the ear and extends onto the anterior portion of the scalp and the upper portion of the neck. It also involved the posterior aspect of the right earlobe. During Mohs surgery, we were able to get a clear margin. I believe it took 3 stages of Mohs surgery before we had clear margins. The resulting wound was approximately 3.5 centimeters long by 2.5 centimeters wide. What we did was come up with an advancement flap that required removal of Burroughs triangles, small little triangles of tissue at the superior and inferior edge of the wound. We then undermined the tissue, advanced it to the edge of the posterior auricular sulcus, sutured that in place, and then used one of the Burroughs triangles that were excised as a skin graft for the defect on the posterior aspect of the right earlobe.
So you had to do a little patch in there. See, the ears aren't the same. So I lost part of my ear here. It's healing up a lot better than I thought.
So he's now 4 months post-op. All of the sutured areas have healed very nicely. The skin graft took very nicely, and everything looks perfect.
These make you feel relaxed all the time. It really is nice.
For additional health information, be sure to check out our Healthy Living blog for the best tips, latest medical procedures, and up-to-date news for modern medicine at our website at bestdocsnetwork.com.
psoriasis somewhere along the way if you get it. Just like atopic dermatitis can be worsened by bacterial infections like staph and strep and things of that nature, psoriasis can too in some cases. And for that reason, in addition to using some of the things like the creams that we use to kind of slow down the growth of the skin, sometimes we use things targeted to try to get rid of underlying bacterial infections. So we'll even recommend bleach-containing washes in some cases, even for psoriasis patients, even though we don't think that's actually directly affecting the psoriasis. If they've got a bacterial infection that's making it worse, you get that better, the psoriasis will get better too sometimes. You do have it for your whole life, but the good news is there are treatments that can put it into remission, and some people go into long-term remission. They may have psoriasis that's really bad for a number of years. With good treatment, it may just go away, and then you can taper the treatment off, and it doesn't seem to come back for long, long periods of time. So it sort of behaves in different ways in different people, and we never really know for sure what it's going to do until we actually treat the person and get them into remission.
Don't forget, for more information on any of the doctors you've seen on today's show, just visit our website. It's bestdocsnetwork.com.
Bestdocsnetwork.com, the place to go. Right now, the place to go is our next best doctor, Candace. It's Dr. Ed Singleton.
I was on a friend's boat and I missed my step and twisted my foot, and immediately I knew that something had happened. It hurt, but surely I didn't think I broke it. My friends were like, "You gotta go to the doctor, Diane, you gotta get that checked out." And I was like, no, it's fine, you know, I must have just sprained it or something. So I thought, you know, just with some time and staying off it, not being active, it'll heal itself. My job requires me to interview doctors as the producer for Best Docs Network, and I was at PAMA interviewing a doctor, and there happened to be one of their foot specialists there.
When I saw Diane's foot, it's like she had on a pair of nice red high heels, and one foot looked like it's supposed to, one foot looked like it was blowing up out of her shoe. And I said, "Is there something you need to tell me?" We sat her down, we examined all the necessary parts, took some x-rays, and sure enough, she had a fairly substantial fracture of the fifth metatarsal. Had it been much more significant, it probably would have been a surgical thing. If she had let it go a lot longer, it would develop into what's called a non-union, or at least a delayed union, and that means that the bone is not healing in a timely fashion. And if it goes all the way to a non-union, that's a surgical problem.
Dr. Singleton was great. Immediately he said, "You need to be wearing a boot." The fracture was such that it could be healed by just staying off it and wearing the boot, the cast boot. Otherwise, possibility of having to have surgery, pins, and all that. And I've heard stories about that, and I just didn't want to go that route.
That's why it's so very, very important to be seen for your injuries in a timely fashion by a qualified foot and ankle specialist. If you want pain freedom, you got to be seen early. She should do fine now that she's wearing it in a very diligent fashion. She tells me she wears it all the time, and she's being a really good patient.
I work with PAMA physicians quite a bit and hear about how they're able to provide their patients pain freedom. So it was really great to be able to experience that.
Breast cancer is a scary thing. It's the second most common cause of death in women. Also, 1 in 8 women will get breast cancer at some point in their life. That is a really big number. For example, if you're out with friends of yours, there's 8 of you there, one of you all is going to have breast cancer at some point in your life. That really is scary. So what do we do about breast cancer? Or how do we discover it? Well, there's been a lot of emphasis over the years on doing home self-breast exams, you know, monthly in the shower. Well, recently the studies show us that that really isn't a great thing to do. Women pick up lumps and bumps and things that they feel in their breasts that require us to do mammograms and checkups and then biopsies, and it seems like the benefit from that isn't that great, and the risks of overdoing the testing and the biopsies is worse than just not doing it at all. So self-breast exam is not as important as it used to be. It doesn't hurt, just don't overcall things. There are really minimal ways that you can prevent breast cancer. Basically, there's a family history is a strong risk factor. Being heavy and gaining weight is a risk factor. And you just need to have your mammograms regularly. That's the best way to detect breast cancer.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education, and the Medical Minute tab. For more information on any of the outstanding doctors you see on today's show, head to the website bestdocsnetwork.com. That's bestdocsnetwork.com. Right now it's time to head to our next best doctor. It's Dr. Paul Worrrell.
Seemed like from earlier years, my allergies, I had just a few. And then as I got older, I was accumulating more and more allergies, or more and more things were affecting me. The allergy headaches, the sneezing, the nose running. So I went to Dr. Worrrell to see what we could do. I've been on all kinds of medications, over the counter, and then on prescription medications.
Over-the-counter medications are available, and then we have prescription antihistamines, and we have nasal cortisone sprays that we use, and other medications that oftentimes are adequate for taking care of allergies that occur just occasionally. And when people are happy with that approach, then I don't think desensitization is necessarily the way to go. But if they've been frustrated by feeling like those were inadequate approaches, then we can go ahead and proceed with that.
So we decided that I needed to go on allergy shots. I chose that path, and I'm glad I did. We decided that I would go on the immune therapy December 2012. The goal is that I will, most of my allergies will be taken care of. There will still be some that there's going to be a little bit of a reaction to, but they haven't been affecting me like the other ones were.
Questions are given to determine that they are good candidates for testing and desensitization. And then they proceed with a procedure that takes about 30 minutes. And during that time, the 48 top allergens in the area are tested on skin testing. The results are measured out, and the determination is made whether they're a good candidate.
My treatment plan is a 12-month plan, and they've already made up all of my serum for me to take, and they refrigerate it at Dr. Worrell's. They hand it out to me as they check my progress and make sure that I'm on track.
We're looking at taking care of those people who have particularly profound allergies, or the allergies that just make them tired and give them the headache that they've had in the past.
I've known Dr. Worrrell for over 30 years. His methods are fantastic. He doesn't just refer you to another doctor to get something treated. If he can treat it here, save you some money, he does. He's been the most fantastic doctor I've ever had.
We're all different. We like different things. But one thing nobody likes is pain, especially when it keeps us from doing the things we love. Luckily, PAMA's here. Whether it's back pain, carpal tunnel, foot and ankle pain, or more, PAMA physicians are dedicated to their specialties and dedicated to your quality of life. Don't let pain keep you from doing the things you love. PAMA, pain freedom.
I was experiencing chronic neck pain, so I searched the internet and found Dr. Farhat through PAMA. I had intense burning down my arms and out of my fingers. Almost felt like kind of like electricity, but also like a hot fire poker constantly.
When I saw her in the office initially, we adjusted her medications so we can help her cope with her condition. Then I did what we call diagnostic medial nerve branch blocks, where we injected enamel medicine around the sensation nerves that carries the pain signals from her neck to her brain. The procedure helped, and as a second step in her treatment, we did the rhizotomy.
He suggested a rhizotomy, burning the nerves in my neck, which kind of scared me at first.
We've done this procedure a few months back now, and Amy has been doing well since.
It was wonderful. I have no pain whatsoever. It's completely gone. Now that I'm pain-free, I am back to work. I work 6 days a week instead of just every now and then. And I am very happy that Dr. Farhat has given me this pain freedom.
She got so much better that she asked her husband, Shaggy, to come and see us. He has something similar in his lower back, and we ended up by applying the same treatment we did on her, on him.
My wife told me about Dr. Farhat at PAMA, and so I decided to come see him. And he says, you know, I'm going to make you pain-free. And of course, I've heard that a lot of times, but whenever he said it, he actually means it, and he actually does, you know, come through. Since then, he has done 2 rhizotomies on my back, and now I'm pain-free. It's wonderful. I'm not limited to my mobility, and I've got my life back. Dr. Farhat is always very polite. He always comes in and greets you with a smile. His staffing is always very nice, very polite, very helpful. I don't think they are ever in a bad mood or ever have a bad day because they're always so polite.
I'm very, 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 very pleased at how much he cares.
Atrial fibrillation, a commonly known arrhythmia that involves the upper chambers of the heart becoming irregular and beating sometimes wildly out of control, sometimes beating very slow and causing the need for a permanent pacemaker. Atrial fibrillation is another risk for stroke, and therefore patients who have atrial fibrillation really need to see their doctors, be evaluated, and get on anticoagulant therapy just to protect them from stroke. Now, what causes atrial fibrillation? That's a question that many of my patients ask. Doc, why am I having this problem? And I say, well, the electricity of the heart can change over time. Sometimes as we age, our cardiac cells can change their electrical impulses, and things can kind of go haywire. So we want to make sure that we look at an EKG each time the patient comes in. It's important to check those things, and ask your doctor to do an EKG if you haven't had one. If you have palpitations, if you have shortness of breath, feeling faint, make sure you have your rhythm evaluated with an event monitor or some type of Holter monitor. It's very important. Atrial fibrillation is something easily treated. Protect yourself. Get your heart checked today.
That will do it. That'll wrap up another edition of the Best Docs Network, which of course features some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives.
For more information on any of the doctors you've seen on today's show, just visit our website, bestdocsnetwork.com.
And of course, Candace, if anyone out there has a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com. So long, everyone. We'll see you next week.